Hello, I am Arpan Roy, a first year medical student. So today we are going to study atrial septum defect, which is a congenital heart defect between the two septum of atria. So let's focus in my iPad. So let's start our today's video. From atrial septum defect, we know that atrial means atrium, septum means wall, and defect means abnormality. Basically, what happens in the atrial septum defect is the hole in the wall between left and right atrium. So what happens from the left side of the right atrium to the right side by the foramen ovule, which is present in the embryological period, blood transfers. Actually, we know the left side of the atrium pumps oxygenated blood to the all parts and different organs of the body, and having a high atrial pressure, and the right atrium pumps deoxygenated blood to the lungs. Left side of the atrium pumps oxygenated blood to all different organs and part of the body having high atrial pressure. The blood actually passes from left to right side in the atrial septum defect due to high pressure of right atrium. So what happens actually at the time of embryological period, there were no walls between the heart. There present one foramen ovule in this position. The foramen ovule remains opened. Foramen ovule remains open at the embryological period, which is because of the getting oxygen from the mother's placenta. From mother's placenta to the baby. Actually, what happens after the birth of the child, the foramen ovule closes after 1 to 2 weeks of birth. But in some cases, there remain small openings which doesn't affect the heart, and which is asymptomatic for a long period of time. Normally, a person can't understand if he or she has any atrial septum defect or not. So what can I write? But after 1 to 2 weeks of birth, the foramen ovule closes. But in the defected persons, it means the foramen ovule remains open or doesn't closes after birth. Having a small openings in the foramen ovule doesn't let you in trouble, which is literally asymptomatic and normal people can't judge any atrial septum defect. And if there will be any small openings in the septum secundum area or septum primum area, it doesn't affect the heart at all. But what affects the heart is that large openings, which doesn't closes after 1 to 2 weeks of birth, which large openings causes atrial septum defect, large opening of the foramen ovale area. What happens if the large openings remains? The oxygenated blood gets transferred into the right side of the heart, and the oxygenated blood gets mixed with the deoxygenated blood and gets transferred into the lung. So it can cause many paradoxical embolus. It can form a clot in the blood. It can increase the BP of the blood, a BP of a person. So blood can travel from different parts. The mixing of deoxygenated blood and oxygenated blood, which can lead you into a trouble and cause high blood pressure. Signs of atrial septum defect is paradoxical embolus forms, clot in blood forms, BP increases, blood pressure of a person or he or she is increases, and which may cause stroke. The surgical enclosure is of highly success rate. In this case, surgical closure is of high success rate. Normally what we hear, lub dub sound from the heart. Normally, but in this case we will hear lub drub, which is an interesting fact actually. So if you understood this topic like a wow, please subscribe my channel. I will upload videos related to many topics as soon as possible, and I will confirm you that from this video my channel will upload various types of history videos and various types of defect related videos, medical type of related videos vigorously. So please don't forget to subscribe my channel, and please have a like button in this video, and please turn on the notification button for getting the earliest when I upload my videos you will get notified. And with that I am ending my video of atrial septum defect. If you understand, please subscribe. Thank you.